And I have sound. Hello, everybody. I am still wearing my scrubs as it was a really long day at work. So I have a couple of journal articles that I've got to go over tonight. Um, so both of these articles are kind of like Captain Obvious moments, if that makes sense, where we are just kind of confirming or looking at data to kind of confirm some of our suspicions. So the first one, and they're both from the Journal of Exotic Pet Medicine, and I think they're both from this year. Yep, they're both 2022. Actually, yes, both 2022. So the first is a study out of Finland looking at uterine disorders in domestic rabbits. So we effectively will always recommend spaying rabbits as rabbits have really high rates in the literature. Estimates can be as high as 80% of rabbits over the age of 4 can develop uterine cancer or uterine disorders that can be life threatening, including cancers. And some of these cancers are really nasty. So, some of these cancers are things like uterine adenocarcinomas, which really readily metastasize or spread to the rest of the body. So, they're terrible diseases. So, we can very easily prevent them by spaying these animals. And previous, notes in the literature say anywhere as high as 60 to 80% of rabbits will develop these disorders if they're not spayed. So, um, we typically recommend routine spaying and neutering, just, for various reasons, including cancer prevention. So, what this study is looking at is trying to determine if this incidence is accurate or if it's more or less than what we kind of expected or suspected from previous data. So, what they looked at were rabbits of varying ages, so a whole collection of different age groups of rabbits that were either surgically neutered, so spayed or castrated, sorry, spayed, because we're castrated males do not have uteruses. It's been a long day. That unfortunately either passed away or were euthanized without a suspected uterine disorder. So they took a whole bunch of animals, uteruses that were available. Um, and if they didn't suspect that this animal had uterine disease, they looked at the uterus anyway and sent out histopath. And then they also, so they had 94 rabbits in that group. They also looked at the uteruses of rabbits that had a suspected uterine disorder. So patients that, were presenting with abdominal discomfort, hematuria, or blood in the urine, hema meaning blood, urea meaning urine, rabbits that are, just not doing well and are intact, and then don't have any other specific findings on X-ray or ultrasound. Um, Whole bunch of different cases where we would suspect uterine disease in rabbits. So only 22 in that group, so a much smaller group, but patients where a uterine disorder is pretty high on the list of differentials. So I'm just gonna zip down here. We're gonna go over these results because the results are kind of summarized here, but we're going to review them a little bit lower. So they do start by saying even a century ago, studies showed that in rabbits, the uterus is the most common site for primary tumors, and we probably have such, um, I guess, such like long-ranging data because rabbits have been used for meat farming and and fur farming for a very long time, since like the Victorian times. Rabbits have been pets. So, um, So this is also referring to rabbits over 3 years of age in another recent retrospective study. So this one here, it's not gonna it's not gonna go to the link. That's okay. We can look at that after. So that's number 5. Hold on. Scroll all the way down. Yeah, so this one that was from 2018 from the Journal of Comparative Pathology, where they were looking at 854 necropsy examinations. So that study kind of confirmed or suggested, based on their data that they collected, that rabbits over the age of 3, which is really close to the kind of over the age of 4 thing that we kind of parrot in veterinary medicine, have a huge increase in incidence of uterine disease, including uterine cancers. So, I wish I had highlighted this earlier. So yeah, so they collected them. Here we go. Okay, this is the results. So once again, the group of rabbits where they didn't suspect uterine disease, which was 94 rabbits, which is a pretty nice sample size. Um, so these again included rabbits that were admitted for routine spay. So there were 57 of those, euthanized without any health disorders or specific clinical signs. Oh, excuse me. Um, relating to the uterine disease. So, if they were just kind of like an ADR, ain't doing right rabbit, or other, reasons for euthanasia, failing to thrive or failing to respond to supportive care. Sometimes that's unfortunately the case where we have to euthanize those patients if we can't do other diagnostics. Or rabbits that unfortunately died at home without any other known signs of uterine disease. And that's a smaller number, it's only 2 of them. So, the uterine disease group had uteri, I love that word, 22 rabbit uteruses. I don't know which one's correct, honestly, that were spayed or euthanized due to reproductive problems. The patients that had pseudopregnancy, um, animals that they had the disease diagnosed by another collaborating vet, if they had a mammary gland tumor, because we do worry about mammary gland tumors in these patients that are intact because of hormonal stimulation, or any combination of these. So, huge age range. So, zero point 0.4, so like 3 months to 10 years, which is great. It's a huge range. 18 different breeds, although sometimes the breed wasn't indicated, which is not uncommon. Often when we have these mixed breed rabbits, we kind of just like estimate the breed, or the file just doesn't have a breed linked or identified on it. So various different breeds, from New Zealand whites to Himalayans to Netherland dwarfs, lionheads, lops, etc. So, hang on, I'm going to scroll down here. Okay, yeah, so here, this is crazy. So, in the group of rabbits that did not have suspected uterine disease, 44% of the rabbits had some kind of changes to their uterus that were suggestive of uterine disease. So that is crazy. That's like almost half of these rabbits that didn't have any signs or any suspicion by doctors that they had uterine disease actually had changes to their uterus. So they're animals that may have um, later developed obvious signs of uterine disease. It's hard to say. And then it's hard to say, like in those cases, are they tentatively developing a nasty cancer that they've been hiding that could spread to their body? Oh, sorry, spread to the rest of their body. Or are they having like a uterine aneurysm later? And that's really dangerous. So that is crazy. That's a huge number of rabbits. So again, this kind of chalks up to rabbits being incredibly stoic animals that exhibit masking phenomenon. So they like to hide signs of illness very, very well because they're prey animals. And some of these diseases can be clinically silent until it's too late. And that's very, very dangerous. That's dangerous in any species. Like it's a terrible thing to have to deal with in medicine. So 12 rabbits in the no, yes, 12 of those rabbits had, oh gosh, sorry, guys, a really long day. I can't stop yawning. I really need more caffeine, but it's late, so I'm not going to have any more caffeine. So 12 rabbits in that group also had neoplastic findings, so cancerous findings. So not just uterine disease, which can, be tentatively precancerous or still life-threatening, but they had cancer. Um, Importantly, 13 rabbits in the no uterine disease group had normal macroscopic uteruses. So the uterus looked grossly normal, but then microscopically, when they examined the tissue via histology, they had terrible changes. So adenomas, adenomyosis, carcinoma, cystic endometrial hyperplasia, and polyps. Rabbits, why do you got to do this to us? So spay your rabbits. This is what the underlying theme is. So only one of the 23 rabbits of less than 1 year of age exhibited something unusual. So cystic endometrial hyperplasia, which is effectively um, a tissue thickening of the endometrium, so the lining of the uterus. So that's something that can tentatively become cancerous. I don't know if we have an exact correlation between that and rabbits, but I believe in human women, if you have endometrial hyperplasia and it goes untreated or unrecognized, of course, as is the tradition with women in medicine, unfortunately, we have a serious bias issue in human medicine against women. It's something that can tentatively become cancerous, from my understanding. So, horrifying. And then in the uterine disease group, of course, 95% of these patients that, they probably had uterine disease based on clinical suspicions, they did have changes to their uterus. So, um, and then in two of them, the changes showed only in histology. So I've definitely seen this in practice where we have had patients that are acting quite sick and they're intact rabbits, and there's nothing else that we can find on diagnostics, or diagnostics are kind of limited. So sometimes we spay them and then they get better. I have seen these patients come back with endometrial hyperplasia on histopathology. Sometimes the histopath has declined, unfortunately. Sometimes it's just a cost issue. Um, so really interesting. So grossly normal looking uteruses in 10% of these patients, which again, this sample size is not nearly as big as the other sample size. Um, oh, excuse me. Um, I have to do these streams earlier, I think. Um, so only histologically, so only when they examine that tissue microscopically did they see changes that are dangerous. So there was one rabbit neutered due to a mammary gland tumor, no pathological findings in uterus. That's interesting. Yeah, so I'm not going to dwell on this. They have some great images of abnormal uteruses, which are horrifying. So bilateral, yeah. So rabbit uteruses are cool. They're kind of bicornate, and they actually have two cervixes because rabbits are crazy. So these like lumpy dumpies here are adenocarcinomas, which is horrible. Adenocarcinoma is a very awful cancer. Generally, if something ends with carcinoma, it's a bad type of cancer. Not that you think of cancer as being good, but there are certainly some neoplasias. So abnormal tissue growths that are less dangerous than others. But yeah, adenocarcinomas are bad news. So they have just charts here of the distributions of things. And again, I am exhausted, so we're not going to dwell on this too much. Um, yeah, so they are talking about some limitations. So the sample size is smaller than they planned, despite the study being advertised, and that's just something that we unfortunately, it's hard to mediate that. Sometimes you really, really want samples, and then nobody gives you samples. And apparently, routine neutering of female rabbits is not common in Finland. That's interesting. Um, did you do intestinal parasite prevalence study? Interesting. Okay. Cool. Anyway, the take home here, if I can stop yawning, the take home here is spay your rabbits and spay them young when you can before they get older and have all these other problems. So, yeah, this is kind of just confirming what we suspected. We absolutely see trends in clinic of rabbits that are unspayed having uterine disease or other associated disease. We absolutely see some rabbits that have macroscopically or grossly normal looking uterus when they are spayed, and then histologically, or when that tissue is examined microscopically, basically, it can be abnormal. And this is a pretty simple thing that we can do to kind of improve the health of our rabbit population. So, we do routine spaying and neutering in our dogs and cats, or spaying and castration in our dogs and cats for various reasons. There is a question as to like what the ideal age is in dogs now, which there is some data kind of backing up delaying it, delaying spaying or neutering. Anyway, we're not going to get into that because I think the science isn't super like crystal clear, and there's a lot of little asterisks on what works best for different breeds and different size dogs and all that. But basically, we're really not losing anything by spaying and castrating these animals early, especially spaying them. I think rabbit anesthesia has never been safer if you have a team that really knows what they're doing, and really does modern rabbit anesthesia. Um, I think that we've come so far in just our exotic animal anesthesia in general, and rabbits are no exception. We have such safe drug protocols now compared to 20 years ago. So, really cool study. super interesting that there were so many rabbits that, weren't suspected to have any kind of uterine disease. And lo and behold, they have uterine disease, even though they were hiding it because they're rabbits. Because that's what rabbits do. They make our lives very challenging.